Preeclampsia is defined as hypertension of at least 140 by 90 mmHg recorded on at least two separate occasions, and at least 4 hours apart, and in the presence of at least 300 milligrams protein in a 24-hour collection of urine, arising de novo after the 20th week of pregnancy in a previously normotensive woman and resolving completely by the 6th postpartum week. Risk factors for preeclampsia. First, pregnancy. Multiparous with a previous history of preeclampsia. Preeclampsia in any previous pregnancy, 10 years or more since last baby. Age 40 years or more. Body mass index BMI of 35 or more. Family history of preeclampsia in mother or sister. Booking diastolic blood pressure of 80 mmHg or more. Booking proteinuria of more than equals to 1 on more than one occasion or quantified at more than equals to 0.3 grams, 24 hours. Multiple pregnancy. Certain underlying medical conditions. Pre-existing hypertension. Pre-existing renal disease. Pre-existing diabetes. Antiphospholipid antibodies. Pathophysiology. Development of preeclampsia is a two-stage process which originates in early pregnancy. In the first stage, trophoblast invasion is patchy and the spiral arteries retain their muscular walls. This is thought to prevent the development of a high-flow, low-impedance uteroplacental circulation and leads to uteroplacental ischemia. The reason why trophoblasts invade less effectively in these pregnancies is not known, but may reflect an abnormal adaptation of the maternal immune system. In the second stage, uteroplacental ischemia results in oxidative and inflammatory stress, with the involvement of secondary mediators leading to endothelial dysfunction, vasospasm, and activation of the coagulation system. Target cells of this disease process are vascular endothelial cells. Cardiovascular system. Normal pregnancy is characterized by marked peripheral vasodilatation resulting in a fall in total peripheral resistance despite an increase in plasma volume and cardiac rate. Preeclampsia is characterized by marked peripheral vasoconstriction, resulting in hypertension, the intravascular high pressure, and loss of endothelial cell integrity results in greater vascular permeability and contributes to the formation of generalized edema. Renal system. In the kidney, a highly characteristic lesion called glomeruloendotheliosis is seen. This is relatively specific for preeclampsia. It is not seen with other hypertensive disorders and is associated with impaired glomerular filtration and selective loss of intermediate weight proteins, such as albumin and transferrin, leading to proteinuria. This in turn causes a reduction in plasma oncotic pressure and exacerbates the development of edema.